Hello everyone, Time with Dr. Nita welcomes you once again, but this time we are starting our first interactive session with two guest medical practitioners. Over the past few months, we've spoken about preconception care, we did a little bit about the pregnancy journey, and then we continued with contraception. In this series, we are going to talk about postpartum mental health. We're also going to talk about postpartum weight loss, postpartum diets, and then we have a few sessions with our trainer. That means somebody who's going to teach us what to do, exercising, and the best exercises for women who have delivered. We're also going to give you a 360 conversation on all these things and then ways of helping us in the postpartum period. So stay tuned as we continue the series. We are going to talk about the postpartum period, like I said. What is the postpartum period? It's a period from the time the placenta comes out right up to 6 weeks after delivery. It's a period where a lot of physiological, mental, emotional, and psychological changes take place. For some women, they have the whole joy of the baby, family members are around, friends are around, they are very thrilled to have their new baby, they are excited, see the baby smile, see the baby poop, see the baby breastfeed. All those aspects of childbirth is really beautiful for them. Some women also experience the downsides of it. They are sad, they are depressed, they go through ups and down phases. Our guest resource person here today is Dr. Alberta Marfo. She's a psychiatrist and she'll talk to us about mental health in the postpartum period. Dr. Marfo, you're welcome to my show.
Thank you, Dr. Nita, for having me. I'm thrilled to join you here today to discuss this all-important topic, maternal mental health. I've been watching your episodes. You're doing some great work here.
Thank you very much. Job. So Dr. Alberta Marfo will talk to us today about maternal mental health in the postpartum period. She'll give us a few examples and then she will introduce us to what it is, how people go through the postpartum period mentally, and then ways of solving them.
Thank you, Dr. Nita. So the postpartum period, as you said in your introduction, is the period after the birth of the placenta and then 6 weeks postpartum, well, after the woman has delivered. And during this period, there are a lot of physiological changes and physical changes that go on. A whole lot of economic changes as well. There are a lot of social pressure.
Yes, talk about
absolutely.
Diapers.
And milk and a whole lot of social changes as well, because, you know, you have to sort of reorganize your life, reorganize your living circumstances if you're going to have someone to come and live with you. So there's a lot of pressure on the mother.
Yes.
And sometimes that changes, like the economic and the social and the physical, you know, there's so much that we sort of, you know, gloss over the mental health of the mother in that period. But
and you know, mental health is not really spoken about a lot in Ghana.
Yes, absolutely. Well, now we are getting there. We are getting better. People are recognizing that you need your mental health to be, you know, good in order to survive, you know, and in order to be at your optimum. So people are it's getting there. It's improving. I mean, you have me here today, so yes, that's progress.
Okay,
yes.
So comparatively, do you have the woman presenting to you in the clinic with mental health issues, or let me say the postpartum woman, do you have them come into the hospital with issues either of depression or whichever type of mental health issue they bring to you? Most
times it's not too common to have, you know, the mother coming in willingly to talk to you about what she's going through.
Okay.
But you have families, you have friends, you have loved ones. When they see that there's something not quite right with what is going on with the mother, then they can ask the mother to come and see us. So we have people coming in, but we are looking forward to a time where people, you know, will recognize their own mental health challenges and then come to us. Okay. But we know that typically in our hospitals, or let's say in our clinics, we don't really have a lot of mental health assessments over there, and these problems usually will start in, let's say, the third trimester, from somewhere around 26 or 28 weeks onwards. Is there a way of getting these women to bring out their problems in those times so that after delivery, even if they have issues, they will be able to
sort them out?
Yeah, absolutely. One important thing is, education, awareness creation, especially, during the antenatal visits in the big hospitals where you have the nurses, the midwives giving education on what to expect, what to eat. I think what can be included is maternal mental health as well. If they are educated during this period, then they are more aware and they know what to look out for. Also, obstetricians can use screening tools, to whilst women are waiting to see them, they can fill out. Some of these are self-fill forms, so they can fill it out. You can recognize women who have risk factors, and then you pay closer attention to them even before they deliver. And all these can, help avert some of these things.
Okay, I was even, with your points right now, I was even thinking about ways of helping these women. Let's say TVs. In our antenatal clinics, people watch a lot of TV when they are sitting waiting. So maybe we could put some of these mental health issues on TV to kind of educate the woman on some of the problems, and then if they come with loved ones, to be able to recognize that
absolutely.
These may be the telltale signs, so that they can be able to come to you as soon as they have any issues like
absolutely we can't overemphasize education and awareness creation, so that's the way to go.